Good morning, I'm Dr Kerry Chant from New South Wales Health with the COVID update for Wednesday the 5th of January 2022. Across New South Wales, there are 95% of people aged 16 and over have received a first dose of the COVID vaccine and 93.6% have received 2 doses. And of people aged 12 to 15, 81.4% have received a first dose and 78% have received 2 doses. There's currently 1,491 COVID cases admitted to hospital, with 119 people in intensive care, 32 of whom require ventilation. And there were 35,054 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and more than 108,000 COVID tests were reported during that period. It is important to know that some of those cases that we are reporting relate to tests that swabs that were collected in preceding days. And so the numbers will jump around, but clearly we are also missing cases because some people and not everyone in the community is getting those PCR tests. So sadly today we're announcing the death of 8 people with COVID, 6 men and 2 women. 1 person was in their 90s, 2 people were in their 80s, 2 people were in their 70s, 2 people were in their 60s, and 1 person was in their 50s. Can I just express my sincere condolences to those who have lost their loved ones. In terms of the key messages, can I not emphasise enough that the important role that vaccination is going to play in keeping us safe and keeping you and your family and the broader community safe. The vaccines work in 2 ways. One is they reduce your risks of having severe disease, but they also potentially stop you from getting the disease and then passing it on. And then even if you do get the disease, it may reduce your risk of passing it on. So it works in many ways, but ultimately vaccination is going to be an important component of our endemic state of living with COVID. That rate of vaccination for those 12 to 15-year-olds has been so stubborn at 81.5%, between 81.4%. So please book in your children for vaccination. And today we're announcing, and again, the fact that the 5 to 11-year-olds are also able to get a vaccine. So please take your whole childhood group and book them in for their vaccination. The school year is fast approaching with the return towards the late January, early February. So please, we'd like to see as many as possible students vaccinated ahead of that school return. Booster doses, again, are increasingly available and access is through general practice, pharmacies, our own vaccination centres. Please book in without delay, particularly urging anyone with chronic underlying health conditions or the elderly, people that may have had vaccine a while ago. Please get vaccinated. It is critical that we get that booster coverage to protect you, as I said, primarily, but it will also have other benefits for your family and the broader community. We still see people that have not been vaccinated admitted to ICU, including young people. And every time I see that, it does cause me to pause of how better we can reach out to those that are not currently vaccinated. So please, you may have questions. It's reasonable to have questions. So I would just urge you to talk to someone you trust, your GP, your pharmacist. Go on to one of the official websites and please reconsider if you've actively chosen not to get vaccinated. Now, there may be members of the community that for whatever reasons have really struggled to get a vaccine, and I'm urging everyone in the community to support people they know to get a booking, to get vaccinated, be it their first, second or booster shots. As I said, vaccination is going to be a key to us living with COVID as safely as possible. There's also some general advice that I'd like to give about living with our current circumstances, and that's with that sort of endemic COVID. As many of us are prepared to return to work from the holidays, it's important to remind people about the importance of mask wearing. Masks are compulsory for those aged 12 and above in indoor non-residential settings. So just remember, If you're going back to work because you can't work from home, then you need to wear them in offices, hospitality staff, unless you're eating or drinking, in those settings. So all indoor settings require masks. Please wear them. They are an important preventative. Also, just a reminder that employees must allow an employee to work from home if it's reasonably practical to do so. And this will help us minimise the number of people travelling to and from work, and then also the number of people in the workplace. Allow that more spacing. So if you cannot work from home and you go to your workplace, again, emphasising you must wear your face mask, and also be very conscious about those settings where you let your guard down. The tea room. A lot of people are taking their masks off in tea rooms, which is reasonable because they're eating and drinking, but those are the areas where we just might let our guard down and are at risk of a transmission point. Remember as well, please do not go to your workplace if you've got symptoms. Your workplace will understand that you've got symptoms, and it is much better for you to be getting a test and isolating rather than taking that COVID into a workplace situation. So thank you again as we move through what's quite challenging times. But we have the vaccinations. The response to vaccination has been amazing. And it is amazing as I walk around, albeit in a limited way, to see people continuing to practice those COVID-safe practices. The fact that people are continuing to wear masks indoors, the fact that people are keeping that social distancing of 1.5, the fact that people are being so respectful as they engage and still doing QR codes in particularly those high-risk venues. I just want to thank the community for their incredible response, and continue to stay safe and continue to practice those COVID-safe behaviours and get vaccinated. Thank you.